Hello, everyone, and thank you for joining the COVID-19 Public Health Action webinar, The Emerging Needs of Childcare. My name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Before we get started, I just want to go over some Zoom housekeeping. For all questions, please utilize the chat box or questions and answers box located at the bottom of your screen. We are not offering continuing education credits for our COVID webinar series. And lastly, all webinars will be available on the Hawaii Public Health Training HUI's YouTube channel. It is my honor to introduce you to our guest speakers for today. Our first speaker today is Dr. Kerri Urosevich. Kerri is the lead for the Network Design and Innovation for Early Childhood Action Strategy. Kerri's main responsibility is overseeing a multidisciplinary collective impact collaborative, which includes 6 teams and over 100 public and private partners, all working to improve the system of care for Hawaii's youngest children. She previously served in both Governor Neil Abercrombie's and Governor David Ige's administrations in this role. Kerri received her PhD in political science with a specialization in conflict resolution and systems design from the University of Hawaii at Manoa, master's degree in international policy from the Monterey Institute of International Studies, a graduate certificate in conflict resolution, and a graduate certificate in nonprofit management. Our second speaker today is Kathleen Algire. Kathleen is the Director of Public Policy and Research for the Hawaii Children's Action Network. In her role, she advocates for children and families at the city, county, and state level, with a focus on healthy families. Before joining HCAN, she worked on issues impacting justice-involved women and economic and fiscal policies in Hawaii and Maryland. Ms. Algire received her MSW from Columbia University. And last but not least, our third speaker today is Deb Zysman. Deb is the Executive Director for the Hawaii Children's Action Network and provides overall leadership at HCAN and works with the Board of Directors and community partners to improve the lives of children. Deb previously served as Executive Director for the Coalition for a Tobacco-Free Hawaii from 2003 to 2012. She has a master's degree in public health from the University of North Carolina at Chapel Hill, and her work has spanned chronic disease, HIV/AIDS, substance abuse prevention, women's health, and community health. Her work has focused on public policy, advocacy, organizational capacity building, and developing community coalitions. Deb was named one of Hawaii's 40 Under 40 by Pacific Business News, and she is the past board president of Hawaii Public Health Association and the Junior League of Honolulu. And now I would like to turn it over to Kerri.
Aloha, everybody, and thank you so much for joining us, and thank you to the Public Health Institute for hosting this conversation about emerging needs in childcare. Similar to many industries across the state, we are experiencing some challenges, and we all appreciate that the economy cannot reopen without childcare. And so this is a real timely conversation. We first wanted to start with where were we pre-COVID with childcare. A study in 2017 by the University of Hawaii Center on the Family and Hawaii Children's Action Network found that the demand for childcare in the state greatly exceeded supply. Although 64% of children of working parents needed care, providers regulated by the State Department of Human Services could only serve 25% of them. And in this visual, what you see is these are centers, infant and toddler centers and preschool centers across the islands. And those numbers represent the number of children that were competing for every one slot. So you can see that the industry, we had a shortage to begin with. And as COVID has hit, we're experiencing even greater need. Next. As I said, as we all know, the economy cannot fully reopen without workers having access to childcare. Childcare is considered essential during this time of COVID-19, yet we are losing providers and we're losing slots. In collaboration with Hawaii Data Collaborative, Patch, and Department of Human Services, we will be putting out monthly data that shows how many programs are open, how many are closed, and slots available by zip code. We will also share what ongoing needs our childcare providers have in responding to the realities of COVID-19. And here is some preliminary data. And this is brand new, literally we received this data last week. So of the 287 survey respondents, and these are childcare businesses, both family childcare and center-based care, and the 287 account for about 30% of overall providers. You'll see that in March, about 178, or around 62% of our providers closed. At that time, there were 10,824 slots available pre-COVID, and then 8,749 slots still available in March because other providers were working still at capacity. In July, we see that 33 have remained closed of the 287, which accounts for about 12%. And we only have 7,190 slots available. So the big question for us was why the reduction of slots in July as programs were opening. This is due to nearly all programs reducing their slots due to COVID-19 preparation costs. Families choosing not to send their children to care for safety purposes, or their families experiencing unemployment and they don't need care right now. Not being able to staff per COVID-19 guidelines and meeting all of the safety requirements, or not feeling safe to reopen themselves. So essentially we're at a 15% closure rate with a loss of approximately 2,000 slots. If we assume that these numbers are representative and only account for about 1/3 of the programs across the state, we're looking at approximately 6,000 slots down right now. DHS shared at the August Childcare Advisory Meeting that around 70% of providers are open and about 30% remain closed, which could be a reflection of only having data for 1/3 of our providers. I did have a chance to talk with Department of Human Services yesterday, and their report was that 30% were closed in June and July timeframe. I'm sorry, May and June. And so we're looking at more opening up in July, which is a good trend and a good direction to be going in. We will be breaking down the data by zip code and type of care, family child care and center-based care, and we'll have that information available by mid-September. The following 2 slides were stories that really stood out for us, and these programs actually were not reflected in the data from last week, but they show breakdown for 2 of the bigger multi-site center-based providers. And so we wanted to just spotlight Business A. For one of our largest multi-site 0 to 5 companies, there was about a 20% drop in enrollment for children birth to 5. Since March, the program has remained open and provided care for children from other closed programs. Those keiki have returned to their programs, which has resulted in an additional 5% drop. They're currently operating at a 25% loss. So when you look at from March to from March, programs went from serving 1,276 to 1,028, so a loss of about 275 children. And then for school age, this particular program provides childcare during intersession for Department of Education, as well as after school care. And so as most of our schools are working remotely and doing distance learning, families aren't in need of that childcare. So their income drop is significant. And so the quote that I'd pulled up from their story was that the total loss for the company is about 8,175 children, revenue loss of about 1.5 million, loss of staff is about 500 that have been furloughed. And the director said more will come if this does not get resolved. Next, the second business we wanted to highlight was also a multi-site company. And they could only afford to open 2 out of their 6 sites. They also shifted from serving 2 to 5-year-olds to only serving 3 to 5-year-olds. So right now, so the number of seats that they had pre-COVID was 600. The number of seats that they have right now is 150 with no openings. And the company does not see this changing for quite some time. And so as we're seeing, the industry obviously is very reliant on employment. And when we have such high employment numbers, they're getting hit from tuition reductions, some enrollment reductions, And then they're also getting hit with all the COVID-19 requirements and guidelines, which cost a lot of extra money in staffing and physical modifications to their environments. So there's a lot happening for our childcare industry right now. Okay, next. Many of them have been working really hard to ensure that KK and staff stay healthy and safe. They're following Department of Human Services and Department of Health guidelines. Examples include site modifications to provide more outdoor learning and play space, keeping kids in bubbles with ratios of 10 or 12 to 1 with no roaming staff. For family childcare, it's 6 to 1. Heavy cleaning throughout the day and frequent hand washing, requirement of masks for children and PPE for staff, limiting sharing of items among KK and washing all items down between uses, limiting enrollment, hand washing stations, implementing more physically distanced activities, conducting daily screenings and reporting to Department of Health and the program community when a child tests positive, and then quarantining as necessary, and then distance learning for KK 3 to 5. Next. So we did focus groups. We've done a series of focus groups since June. And then in response to the patch survey, we're learning a lot about what the industry needs. There's significant funding needs for the following: site mods to adhere to the physical distancing recommendations, just the ongoing business expenses like healthcare costs, rent, and utility assistance, extra custodian staff for cleaning, additional staff. And the reason that that's so important is they're required to not have teachers and support staff roam between bubbles and between classrooms, and so they do need additional staff. Prepackaged meals, subsidy or scholarship for families, providers that are ineligible from receiving funds because they're faith-based providers unfortunately can't access any of the CARES monies right now. They also have technology costs for KK that don't come to school, so devices and cameras and Wi-Fi. Some of our programs, and it's really dependent on where they are in the islands, need increases in enrollment to help pay for costs. Small business support, including legal advice on liability, training on business administration and effectively using technology, additional paycheck protection programs to avoid permanent staff loss. The ongoing cleaning, sanitation, and PPE supplies was number one. That's something we heard the most about in the focus groups and the surveys. Access to the CARES money that is currently available but has been slowly dispersed. So the state has right now about 26 million in CARES money that can go to the childcare industry. And it's moving slowly. And then grants with limited restrictions to address the various needs right now. So just before I turn it over to Deb, I think the big kind of takeaway for us is childcare is essential, and we really have to do everything we can to protect the sustainability of the industry, because we want to make sure that when the economy does have opportunity to recover, that we actually have childcare in place. And right now it's a little bit frightening. So with that, I'll turn it over to Deb.
Hi, so I'm actually be doing the next part. Thanks, Kerri, for setting it up so nicely and for going into the needs of the industry. So as Kerri mentioned, right now, the way that childcare has been operating is very different than how it has traditionally operated. So we traditionally think of childcare as being 0 to 5, but we're actually seeing, because of the distance learning that DOE is doing and many private schools, that childcare really does encompass like our children 6 to 12. So we've broken out to talk about the different options that families and guardians would have available to them. So you have your traditional child care centers and your family child care. They're still operating, but as mentioned before, many are operating with reduced capacity. So they're serving fewer students than they were before. But then we also have some new options for parents through the federal paid leave programs that I'll talk about in a little bit. For our older students, our older children, this is actually a little bit more challenging. So for our 6 to 12, there are not as many places providing care for families that, that families are able to access. So when the schools are doing distance learning, parents are still having to work. And so, you know, caring for a child, participating in distance learning while working is overwhelming. There have been a number of studies to show that, you know, parents are really hanging on by a thread. And so we do think that, you know, additional child care for our 6 to 12, maybe even a little bit older, depending on the child, are really necessary at this time. What we've seen nationally is some of these enrichment hubs kind of coming online that the community is supporting through some of their CARES funding. And so we are hopeful that that is something that can take place here. I know on some of our islands, I believe Maui is already doing something like this. We have a couple of programs here on Oahu. However, the programs do come with an additional cost. HCAN and Hawaii After School Alliance surveyed parents twice, one right after the shutdown and then another when you know, schools were talking about returning and when childcare was starting to open up to find out what were parents' needs. And a lot of parents indicated that they would need for their child to return to care, but that they couldn't take on an additional cost. And so for our school-age kids, this is really important because every program essentially is an additional cost for families. And we know that at a time when unemployment is high, hours have been reduced, families are already struggling to make ends meet, any additional cost is a burden that they're not able to meet. So again, hopeful that we'll be able to see some support from the state or the county to make sure that our kids 6 through 12 have a safe place to go, and so that their parents are able to work and they're able to receive the care that they need. Next slide, thanks. So, so there are some resources that families can utilize to pay for traditional childcare, DHS regulated childcare. As Kerri mentioned, the state did get additional funding through the CARES Act and our Child Care Development Block Grant that can be used for subsidies. Additionally, federally, waivers were put in place that allowed the subsidy to be open to a wider, you know, variety of families. So now, I would urge anyone who's currently paying for childcare to please apply for the subsidy program. Right now, there's no income restriction, there's no income cap. Some of the work requirements are also temporarily relaxed because we know that people have been furloughed or their hours have been reduced. And so DHS has done, I think, a really great job in trying to ensure parents, families know their rights. They've seen, you know, like, you know, almost doubling of applications, but I would urge anyone who is currently paying to please go apply for the subsidy. There's also county level funding. I'm highlighting Honolulu County because I know that they still have funds available. I know that Hawaii and Big Island and Maui, I think, have funding, but at the time of the presentation, I wasn't able to confirm that funding was still available. But Honolulu County does have it, and you can apply for Aloha United Way and the Council for Native Hawaiian Advancement. There is a couple of steps to the application, so just know that going in, but there's funding specifically for childcare expenses. And at this time, if you have lost your childcare, you're in need of childcare, Patch, the People Attentive to Children, are a really wonderful resource in helping folks find the care that's available. I think that, you know, there are programs that are not accepting children, but there are also programs who maybe lost some of the children they were serving, and so there are spaces available. Patch is a great resource for folks to get connected. You can go to the next slide. So another option that folks have in terms of caring for children are the paid leave programs that the Family First Coronavirus Response Act created. So we have two different programs. We have the paid sick days program and the expansion of the paid family and medical leave. They do have slightly different eligibility requirements. So for paid sick days, it does not matter how long you've been with your employer. If your employer has less than 500 employees, and more than 50, you are covered. If your employer has less than 50, you might still be covered. You just need to have that conversation with your employer. So originally, you could use the paid sick days program to take time to receive paid leave if your child care or the school was closed due to COVID. The Federal Department of Labor, who administers this program, they amended the rules to include distance learning. So now if you are unable to work because your child is doing distance learning, whether that be full or part-time, and there's no other option for care, you're eligible. So this program, it's capped at $200 a day or 2/3 your pay, and it's for up to 2 weeks. You can take it in increments. The Federal Department of Labor is asking employers to be as agreeable as they can be with parents, and so whatever that increment looks like, whether it be 1 hour, 8 hours, they're really leaving it to the employer and the employee to figure that part out. For the expanded paid family and medical leave program, that is an expansion of an existing program that is normally unpaid, but that does have an eligibility requirement where you have to have been employed with that employer for 30 days, and same rules around the 500 or less, 50 or more. This is for up to 10 weeks of leave, but same pay structure, so $200 a day or 2/3 pay. And again, you're not required to take all available leave at one time. If you feel like you might be eligible for this program, but you have questions, feel free to reach out to HCAN. You can reach out to myself or to Deb. On our website, which is at the bottom of the slide, we actually have a resource page dedicated to the paid leave programs, and we have a couple of employer forms already on there, so DOE and the state's DHERD paid leave forms. And we also have the phone number and contact info for the Department of Labor. If you feel like you should have been granted this leave, but you were denied, the Federal Department of Labor has a hotline for you to call. I've called just to chat. They're wonderful and an amazing resource. So if you have any questions, also reach out to them. We really want folks to take advantage of these programs. They're there for a reason. Your employer is refunded the cost through a tax credit, so there's no cost to them. We can move to the next slide. And I am now turning it over to my executive director, Deb.
Okay, thank you so much, Kathleen. So I'm going to just sort of draw some things to a close and talk a little bit about what's next. Where are we going in the future and how perhaps you can help around this issue of childcare. So as Kerri and Kathleen mentioned, this is a complex and multi-layered issue. I think due to the pandemic, we have realized just how essential childcare is to our economy, that a good chunk of our workforce does have children under the age of 12 who cannot be left home alone, and really how frail our childcare sector is, that we are concerned that potentially 30% of our childcare seats may disappear in this. We often are talking about other large businesses that are essential and we cannot afford to have them fail. I would say that, in my opinion, childcare is one of them, that it's become very abundantly clear that without good childcare, so much of the rest of our economy will really falter. And we're seeing that now where folks really cannot go to work when they have small children at home. So what is next? This is one of those issues where it does take all of us, and we would call on all of you on this call to help out from whichever kind of vantage point you sit. We have been encouraging businesses to support families as best as they can, whether they're a large business or a small business. This is really unprecedented times. So things that businesses can do, things like support teleworking whenever possible, and that might include teleworking with children present. Many days you see my kids run through the screen here at my own house. If employees for the sector that you're in are unable to telework, if you're a grocery store, a bank teller, face-to-face work, really to give employees the maximum amount of flexibility in scheduling as possible, to work with folks to work potentially odd and off hours, and also to give employees as much advance notice of scheduling as possible, even more advance notice than in pre-pandemic times, so that people can try to plan if they need childcare. Kathleen really just did a nice in-depth dive into the different sick days and family leave programs. We think they are not well known here in Hawaii. We have not been promoting them as much as possible, and many, many workers are eligible. So asking employers to ensure that their workforce knows that is an option. As Kathleen mentioned, it does not cost the employer anything. You are reimbursed for it as an employer. So again, to allow people to be home if they have young children under 5 or they have children home doing distance learning. A few employers may want to look at offering relief time, right? Some additional flexible paid time off as well. And then if possible, some employers are providing their workforce with resources for well-being and mental health. But I think flexibility is key. And so to really work with employees right now to make sure they can continue to work. Congress continues to debate what to do next. And our delegation has shown great leadership in this area, but we have not seen any of these measures move forward that are here. So the HEROES Act, you've probably seen in the news, has been discussed. The House passed it back in May. It has not moved on the senatorial side, looking at trying to put more money out to childcare, either for families directly or for childcare providers. We've also seen the Childcare is Essential Act, again, did not move, but included a $50 billion childcare stabilization fund, and then the HEALS Act. So again, trying to have childcare grants as well as subsidy. So the issue we have right now with childcare, we have short-term needs and long-term needs, and they both really need to be considered. So again, short-term right now, we know that there are some families that need to be sending their children to care. And we want to make sure that they can afford it so that it's low cost, if not free. There are more options presently for children that are young, so the kids birth to 5. That, as Kathleen mentioned, there's actually pretty broad coverage for any family really who needs to be tapping into some funding to help pay for that childcare. It's there. What we don't have robust coverage for right now is families with children at elementary school age range. And we don't want children that are 5, 6, 7 years old being left home alone while mom, dad, whomever is caregiver needs to be face-to-face at a job. So making sure that families who need care for their children now are able to access resources to have that care either be very affordable, if not free. The longer term question then is around how to make sure that our childcare industry stays afloat. Some childcare, as Kerri mentioned, has remained closed. We want to make sure that childcare is able to just continue running as a business. So even if they're serving far fewer kids right now, which was what we're seeing, childcare that is open they will tell you they are bleeding money, right? Because they maybe prior their program served 30 kids, and at the moment they're only serving 12 children. So we want to make sure, we don't want them to have to raise prices sky high for families when they're serving less kids in this time, but we need them to not be driven out of business because they're only serving us a smaller number of children right now. That's the longer term question. How do we ensure that our childcare industry does not go out of business in this time, that we're in a really bad situation post-pandemic when we see more families send their children back to care. So I would say one thing you can do is call your Congress folks, your representatives and your senators, and really encourage them to keep fighting. As I mentioned before, the Hawaii delegation has been strong in this area, but keep pushing them and discussing how this is necessary. And then finally, at HCAN, we are often working to amplify family voices. So if you or families you know are struggling with this, either not being able to find childcare, not being able to afford it, you know folks who are small businesses running childcare, if there are stories to share, that is really helpful, especially right now as we're pushing for more options for the elementary age children. those stories are quite critical. So this is on our website. You can go there and give a description of like what your family situation is like, and we will contact you to get some information as well. There is also a few other things right now. There is an active Working Families Coalition. If you are not a member and wish to join, there's information on our website. They have just put up a petition really asking the governor and state lawmakers to make sure they're getting out the CARES Act money. We are still sitting on millions of dollars, both for childcare and also direct support for things like rental relief for families. Time is ticking. Those monies need to be expended by the end of the calendar year. So that's another area as well to really help advocate and make sure that especially our low income families get the resources that they need. And I think that's it. And we want to spend the remainder of the time doing some Q&A.
Thank you so much to all three of you for presenting. And as a reminder, if you haven't already done so, please feel free to put your questions into the chat box or into the Q&A box at the bottom of your screen. Our first question we have is, if you can, what is the definition of employer? For example, for state workers, can each department under 500 employees qualify, or does this make them ineligible as a state of Hawaii employee?
No, the state is covered. I should have mentioned that the state is automatically participating in the program. And we have on our website, we have the Department of Human Resource Development, their form that they are requiring for use of the paid leave programs. So you can check that out and see what other information they're asking for you to provide.
Thank you. Okay, second question we have is, since there is no end in sight for COVID-19, what should employers do now to ease the burden for Hawaii's working families? Do you have examples of policies in teleworking flexibility that we can use to communicate to our staff?
I think, yeah, I think I think what Deb outlined, that was what we had heard from parents they were asking for from their employers. It was like that flexibility and willingness to come together and work. We are looking for good telework policies in place. What we're tending to find though is at various levels, we're finding telework policies that say things like you could not be working and caring for a child at the same time. And so and there are many employers, many departments that identify that as being, that was obviously pre-COVID, that's what people thought. And so I think everyone is trying to figure out what does a new telework policy look like. And in that interim, while we still kind of are working through that as a community, that's why we're suggesting that the flexibility and then supporting employees if they're able to take the paid leave programs. We really look at it as a partnership and not an employer versus employee.
And I do think there are, even pre-COVID, some national resources that we could definitely find and send along to you stuff to get out to the network that we're looking at, the teleworking and looking at creative flex time solutions and others to reduce operational costs, but also to meet family need. So they exist. I think we could probably find some examples.
Okay, thank you. The next question we have is, can you walk us through the process of applying for childcare subsidies? What are the requirements?
My suggestion would be to go to the DHS website, or the subsidy website, because they do have a checklist and they do have all of the necessary information and contact information. Otherwise, we might spend 15 minutes walking you through the process. But I highly encourage you, echoing what Deb and Kathleen said, is with the eligibility requirements being lifted for income, now is the time for families to apply.
Thank you. Next question we have is, many families are struggling with having to ensure that their kids' distance learning needs are met while balancing social and cognitive development needs. Do you have resources on how to manage this?
I'm laughing because I'm one of those parents. um, I don't know that there are great resources. I will defer to Kerri and Kathleen. I think this is, again, the juggle that we have, which is where I think the best thing we can do is really ask employers to be flexible with families. We know families tend to be willing to work, but we are hearing from lots of employees that they would like to work, odd hours at nighttime after the children are asleep, on a weekend when they have another member of their family that can watch the kids, or be allowed to work with kids in the background if they need to, or be allowed to take partial family leave as well. Even if it might not be every day, all day, but people might need 2 or 3 days off a week in order to make sure their kids are doing the distance learning. And Kerri, do you know of other resources?
There's programs themselves are it seems like the resources are being put out by program. So if your child's enrolled in a preschool program or an infant and toddler program, or even a K through 12 school, those resources should be disseminated through those programs. I think we're having this big conversation at the state level around, is the 8 to 3 on Zoom the most viable? And we had this among Kathleen and Deb and I, or is the more asynchronous type learning more effective because the kids then have more downtime and have more autonomy in the working on their work versus having the parents side by side with them through the Zooms. And I think people are learning. They're trying to figure this out. I think for a lot of families, the shutdown of the outdoors has been tough, because I think that's a really also an opportunity to buffer some of the social and emotional stress that our kids are feeling, and buffering the distance, the screen time. So I think getting outside as much as you can with your kids, and echoing Deb's, providing real flex time for families that have children at home right now is critical. I'm sorry that I can't direct you to a key resource. All of that's being developed as we speak.
The Executive Office on Early Learning had put together some resources for families. They would be geared towards younger children, but they were able to compile many different resources for early learners, emotional well-being, how to maintain social connectivity. So I would encourage folks to check out their website as well.
Great, thank you so much. Next question is it true that you have to exhaust sick leave and vacation pay before qualifying for FFCRA?
No, that is untrue. You might wish to do that because that would be at full pay, whereas the Family First funds is 2/3 of pay up to $200 a day. So you would be taking, with the Family First paid sick and paid family leave, you would be taking a pay cut, right, in that time. But you do not need to use, if you have existing sick leave or vacation leave, that's usually at full pay. It's your choice.
Thank you. Okay, so this question looks like it's going to be 2 parts. So the first part is, are there tax incentives or grants to have a classroom at offices for working parents or single working parents to bring their children to the workplace classroom under supervision?
Any employer, and Deb would chime in if I answer incorrectly, but any employer can start an on-site childcare classroom as long as they get licensed. So they can work with the Department of Human Services to get that stood up in the workplace. So that's definitely an option. In terms of tax cuts and tax breaks, I will pass that to Deb.
Yep. And I'm looking at Kathleen. Not that I am aware of, but I would also really encourage, we have been concerned that folks might start opening non-licensed registered childcare. which is illegal. And so if employers are looking to offer on-site childcare, I think that's wonderful if they're able to do that, but you do need to get licensed through Department of Human Services in order to offer childcare. So, but I don't know of any tax credits locally or nationally.
And the second part was just maybe some considerations if somebody is thinking of this. So it says maybe parents sharing the days or shifts in the classroom, possibly to hire a person, young adult, college intern, or mature adult. But it sounds like from your answer that it could be doable as long as they get licensed.
Yeah, I would just echo that there are, it is clearly outlined in like what is considered childcare and what is not considered childcare, and it has to do with number of children and number of hours. And so I would, if you have any questions, I would reach out to the Department of Human Services, their childcare programs office.
Great, thank you. This question is for Kathleen. Any programs like these for larger employers?
Unfortunately, no, and that is something that Congress has kind of brought up repeatedly, that we need to close the gap to ensure that everyone has access to these programs. It is something that some states are taking on themselves, looking to ensure that the 500 and up are still covered, but unfortunately at this time, it is limited to those with 500 or fewer.
Steph, could I answer just real quick for the question before too about other resources? I think Steph will be putting in the chat some PDFs that our staff have put together for resources for providers, financial resources, and then resources for families as well. The other option for families is at cares.com, which is a website that has providers that will come to your home as well. And so I would also encourage all employers that are on the call to share these resources with their employees, because there's other options out there that are a little bit less known, but still viable. And I think with families getting stuck right now, a lot of them are looking for different types of care.
Yes, thank you. And I do want to echo what Kerri said, that all of the resources being mentioned on the webinar today will be included in our Mahalo email that will be sent to you later this afternoon. So next question we have is, what kind of childcare is available for a child with autism or other limitations?
It depends, I think, on the age of the child, because there is some school-based care that is supposed to be available. And if it's not, please let us know. But yes, I think it might depend on the age. And then I saw both Kerri and Deb also had some thoughts.
I was just going to share for births of 5, the best thing to do is to reach out directly to Patch. And then they will connect you with programs who would be able to meet the needs of the particular, those particular children, because they all have different and unique needs. And so you'd really want to have a high touch conversation with the provider to make sure that the supports were available.
Okay, thank you. Sounds good.
Next question is, similar to childcare, is there student support that work with families that are distance learning? Is there a list of resources available for families that have multiple children in school but all are distance learning?
We are in the process of trying to pull that list together. So Hawaii After School Alliance has kind of taken the lead on this, and so they are working across the state to identify programs that have care available. And supposedly we had heard that DOE was also going to do some supports, but it was a school by school decision. So it's unclear how many schools are participating in that right now.
I would also note, Department of Education has set up the Ohana helpline, which I have not called it personally yet. I might get to that point this week, folks, though, which is intended to help, again, with the children K-12 that are working on distance learning, with help with connectivity, with helping families navigate all the different platforms and services and things of that sort. However, I don't know too many of the details. It is a new service that DOE has just stood up, so I'm sure they will be working out the kinks in the coming weeks, but to try to provide some additional support, because they do realize that for many families this is brand new and it's many different platforms, and some of us parents are less tech savvy than others.
And for birth to 5, most of the KIKI that are distance learning are between the ages of 3 and 5. And each program is using different programming. So there isn't a uniform recommendation. Our Executive Office of Early Learning that provides public pre-K for 4-year-olds is doing programming in person. They do not have a distance learning program, but it is program specific.
Can I just add in one thing though also? At HCAN, we have been trying to compile these resources, as Kathleen mentioned, so I'm going to crowdsource it to the 100+ folks on the call today as well. We do have a COVID resources page up on our website with how folks can find childcare or food, and we're hearing more and more the need for these kinds of resources as well. So if you know of something and you hear about it, please send it to us so that we can add it to the list, because that's honestly the way we have found resources up until now in the pandemic is crowdsourcing through groups like this. So if you see something that's working for you and your family or people you know, please let us know at HCAN and we can add it as we start to compile those for folks.
This next question is possibly for Kerri. What are some of the challenges those in childcare have faced recently regarding metabolic issues, such as providing shots or medication?
It's a great question. I would assume, and Deb and Kathleen, correct me if I'm wrong, I would assume that the processes and procedures would be the same pre-COVID, that they should still be, you still have all the waivers, right? You still have all of the medical requirements and medical paperwork that is required of families to submit. So I wouldn't see there being a change to those processes.
Okay. Next question is, how many providers have transitioned to virtual delivery? Was this captured in the latest patch survey? How many more are planning to transition to virtual distance learning?
That's a great question, and we did not capture that in the survey, but I will make that suggestion to Patch that they include that question in the upcoming survey. Just by, through what I know in terms of stories, programs like Aha Punana Leo and Kamehameha Schools, which are big multi-site providers, they've all gone virtual through December. But it's really, it's kind of all over the place based on program and based on family need also. And, a lot of programs have done surveys to find out what families want and need. And so it really, but we don't have the data on that, but I can definitely recommend that to Patch. So thank you.
Next question is, other school districts have provided free childcare for teachers. Has there been any discussions with Hawaii DOE about this?
There has, but it's been on a school-by-school basis. I don't know of any that actually stood up childcare though, but I know that there were some principals had reached out to inquire about it, but nothing from a state level down.
That's a great idea. Encourage them to do it.
Next question is, are there any employers using CARES funding to offer reimbursement programs for employees who need childcare tuition assistance?
There are not, but the CARES funding went directly to government entities, and then it's been granted out to private or nonprofits, depending. And to be honest, like, it's very specific what that funding can be used for, which is one of the reasons why getting like the CARES funding for childcare to childcare providers has been a little bit stalled. So I don't know for CARES if there was anything for employers, like private employers, that would have been available to them for that reason. Like for the Paycheck Protection Program and for some of the SBA stuff, I'm not sure if that's something that would have been covered.
It would not be covered by the PPP, the Paycheck Protection Program, or the SBA small loans. Those programs were really to help employers pay for rent, utilities, and payroll. That's what those are for. Again, very specific. So if you had other costs, you couldn't use those funds for that purpose either. But again, through this calendar year, almost all families should qualify for the child care subsidies through Department of Human Services. Now, again, that's predominantly for young children, right? So when they're in out of school time, but families with older children as well can qualify, but probably for a smaller amount because it's for the 2:30 to 5:30. It's the after school portion you can qualify for.
And if families are having a hard time filling out their paperwork, please encourage them to contact Patch because they can walk families through that process.
Next question is, can employers be forced to provide flexible schedules and or telework for those employees that have childcare needs?
No, but that's actually, I mean, that if the employer is within that 5,500 range, that would be the perfect case for the person to take the paid leave programs. But no, there's not anything that requires it. We would hope that, again, like employers would be as flexible as possible.
Next question is, if the employer is not being flexible to allow childcare during telework and FFCRA runs out, are there other options for the employee?
Again, I think the options would come through the resources that we'll be sending out, you know, looking at cares.com, looking at, you know, one thing that I think is somewhat creative in terms of having somebody come in and help, especially for school-age children, is a lot of our, you know, older middle school and high school kids right now are done around 2 o'clock. Some are done even earlier. And they could come in as helpers. They could come in as, I think there's some creative ways to look at some childcare considerations, assuming you're staying within legal requirements.
I would also say this is a great opportunity to advocate to our congressional delegation to extend the paid sick days and paid family leave. This is not a federal benefit that workers in the US have really had. Many other countries have mandatory sick days and paid leave and have for years for caregiving if you have a sick child, for a new baby, things of that sort. This program is only in place through the calendar year right now, but I do think it's a great opportunity for advocates to say why they need this program and why it should extend, you know, indefinitely, or at least through 2021, you know, through the pandemic.
And just to provide a little bit more intangible recommendations on this, I also think that there's a real opportunity for us to think strategically and to transform work environments. You know, I thankfully work for a very progressive organization, the Omidyar Group, and the conversations that we've had is we have staff, you know, across the globe, and people are working at 40%, and some people are working at 125%. And then there's everywhere in between, and that changes week to week. It changes month to month, depending on what's happening, right, in this COVID-19 space. And so we've worked hard internally to figure out where can we be most flexible, how do we allow people to use their PTO for real PTO, right? And if it's that they're having childcare issues, how do they delegate some of the work? How do they make it up in the evenings? You know, we've talked a lot about that flexibility, but I think we really have to be bold as employers right now to be thinking creatively. And, you know, what we say to our staff is just get the work done. You know, however you need to get it done, get it done. And so I think it's a challenge for all of us to push ourselves in that direction.
I would like to highlight that for our parents, our working parents, where telework is not an option because of the type of work that they do, that, we have known about this need for a long time, and we have not taken any action on it as a state, as a country. So to echo what Deb said, and then to also, the child care subsidy is there. If you had exhausted your Family First Coronavirus Response Act paid leave programs, I would also suggest maybe reaching out to Deborah at HCAN. There might be, that. I think that this is exactly that's the exact story that we want to highlight and we want to bring forward, because there are a number of folks who are not working right now because of childcare, and it's because their work is not able to telework, and we cannot leave those families out. So we need to make sure that the solutions we move forward are inclusive of everyone.
Can I add another plug also on that? I also would really implore those of you on the call, the childcare industry as a whole, both in Hawaii and nationally, has never had much of a voice, a strong voice, not like other sectors, not like airlines or banks or other things. And I would argue that it is largely because childcare has historically been provided by women. Much of the childcare industry is small business, often by new immigrant women, low SES women, people who have been disenfranchised in many ways and do not have the same power and voice as other industries. But it is a vast and important industry across our nation. But I think this time has really made it apparent to me how we need to be calling on others that have bigger and more powerful voices to stand up and advocate for resources to go there. So again, there's the family resources, like the working families. But if we let the childcare industry fail in this pandemic, if we let a third of childcare close because we are not providing them the support, we are all in big trouble. And that stands for families across the socioeconomic spectrum in whatever kind of work that they do. But I think we have often left the advocacy for childcare to those providers and those small business owners, and they do not have the largest voice that we see in other, they're not the powerful restaurant industry, they are not the powerful banking industry. And I think it is upon many of us to ensure that the industry does not fail and gets the resources that it will need to stay open so that it can continue providing amazing care for all of our children.
Just want
That's the end of my rant.
Yeah, that's awesome. I just want to echo what Deb's sharing and also encourage you. I think it's important to contact our congressional delegation at the federal level, but equally as important, and honestly at this point even more important, is to contact your local representatives, because what we're hearing even among the state people making decisions about how the money is being spent, somehow childcare keeps getting left on the fringe and on the margins. Even though they'll say it's important, it ends up slipping and slipping and slipping. And it's not a unionized industry. And so it really does require all of us, and especially employers in the business community, to be the number one advocate. So thanks, Deb.
I do want to honor everyone's time, and I think this is a beautiful way of ending. But I do want to ask Kathleen if you have any last minute thoughts you want to leave with the attendees.
I would just encourage everyone to apply for childcare subsidies. If you haven't and you're paying for childcare, contact your local representative, senators, governor. Let them know that childcare is an issue that you believe in. And let us know if you're having difficulty accessing programs or accessing subsidy. We are definitely all here to help.
Great, thank you so much. So I just want to say a big mahalo to Kerri, Kathleen, and Deb for joining us today and being our guests. I want to thank all of our attendees on Zoom. I want to thank the HIPHI staff behind the scenes, helping make sure this webinar runs smoothly. Just as a reminder, we are hosting our webinars every other week, so please save the date of Wednesday, September 16th from 1 to 2 p.m. for our next webinar, and we hope to share the topic with you all shortly. Mahalo again for joining us today. Please stay safe and healthy, and we hope to see you in 2 weeks. Aloha.